My name is Dr. Timothy Gray. I'm an orthopedic surgeon. I work at Benuti Orthopedics in Effingham, Illinois. In my practice, I see a lot of patients that come in with an acute knee injury, minor twist, pain, sharp irritation in the knee. Through history, physical exam, and some diagnostic testing, we'll often diagnose a medial or lateral meniscus tear. I like to go through the anatomy and what's going on with that tear so the patient better understands what's going on and what we can do to help them. The knee joint is basically a anatomic ball bearing. You've got a round thigh bone making contact with a relatively flat shin bone. In order to help distribute weight, we have two pieces of cartilage called meniscus. I refer to them as kind of C-shaped gaskets that lay around the outside to help that round ball roll on top of that flat surface. This allows us to get from point A to point B. If you load that joint and have a twist, sometimes you can tear that meniscus. When you have a torn meniscus, that piece can then flip around and it can move in and out from underneath that rolling ball bearing. And that can cause pain, locking, catching, and irritation to the joint. Ultimately, it can cause damage to the joint if it's left there long enough. Most instances, there's three ways this can go. Some people can chew this free piece up on their own. Basically, the rolling of the cartilage, the rolling of the bearing, the cartilage tear is small enough that the problem can solve itself over time. About 5 or 10% of patients probably can do that. Some patients learn to live with it. I'll often have patients come in and say, I hurt my knee a couple weeks ago, but now, doctor, it's feeling a lot better. Well, if you don't roll the joint, the piece can't float underneath and really cause you the pain. Most patients require a surgical intervention, knee arthroscopy. Knee arthroscopy is 2 stab incisions on the front of the knee. We introduce a fiber optic pencil and a vacuum shaver into the knee. We remove that free edge that's torn, leaving behind as much of the normal tissue as we can in order to allow the bearing to roll freely and not have those pieces going underneath. If the problem is ignored long enough, and if you continue to have pain, catching, locking, this can cause damage to the bearing, much like sand in with the regular bearing. It can cause nick to it, damage to the ball bearing, damage to the round surface, and it can lead to arthritis, and that arthritis can lead to more complications down the road. If you think you have this problem, if you have had damage to the knee, if it seems to be locking and it's not getting better, please feel free to contact our office, Benuti Orthopedics at Effingham, Illinois, and one of our physicians will be happy to see you, evaluate you, and see if this is your problem. Thank you for listening. Hey, I know I just signed off, but I've got a little bit more information to tell you. If you've listened to my vlogs, and I appreciate you listening to them, if you're interested in more information on athletic knee injuries, I have gone on Eastern Illinois' channel of Being Well, and we talk more about athletic knee injuries. We're putting this on today on Tuesday as opposed to Wednesday like we usually do, because actually I am on Being Well tonight at 7 p.m. on the Eastern Illinois channel. It's about athletic knee injuries. Or if you miss it tonight, they replay it again at 12:30 on Wednesday afternoon if you want to see it on the Eastern Illinois channel. Or if you miss it those 2 times, Eastern Illinois also posts it on the YouTube channel that you can look it up and get more information on athletic knee injuries if you have an interest. Thank you again for listening. I really appreciate everybody who follows my vlog. Bye.